It's Dr. Morton. All right, so today I'm going to go over Fear Free for felines and go over a lot of the low stress handling tips for cats and Fear Free. A lot of this is from Dr. Sally Foote, and credit goes to her. And so we'll start. So fear-free treatment of cats begins before the cat even gets into the building. If you already know they're stressed at their visits, you want to send home gabapentin for the owner to give 2 hours before their exam. All it takes is one experience that was stressful, painful, or fearful to them and has embedded in its memory. So emotion, fear, plus physical trapped equals permanent. So all of the elements, human hand, the table, the tech, the vet, the syringe, the pinch of the needle, all huge anxiety and aggression triggers. The last memory is the lasting memory. Next visit, the carrier, the cat's hissing, swatting, trying to escape when removed from its carrier, put on the table, causes trigger escalation. Touch, motion, and noise. Those are the 3 biggest triggers. So triage your feline patients, assess what's needed to compare it to what is wanted, usually by the DVM, keeping stress and agitation at an absolute minimum. Fewer hands, not more. Feel away is everything. All the time, before getting the cat, spray a feel away towel, your hands, smock, scrubs, everything. Spray a napkin, squeeze it into the carrier, plug-ins going all the time. Use rewards often. If you don't touch the cat, that's a reward. So cats can escalate quickly and can also de-escalate quickly. Ham-flavored baby food is probably the best, and then turkey baby food after that, tuna, whatever else you have had success with. I've had a lot of success with easy cheese in cats, actually. Tip, use a flat container, like a cottage cheese or Tupperware container. They can be offered it on a tongue depressor or on the table in their carrier, and then take short breaks often, need versus want. Have the owner remove the food by 9 p.m. the night before. You can mix gabapentin with a bunch of different things. Lactulose is really palatable to cats. So cats that are hiding, and on this scale, 7, oh, of course it's backwards. Well, that's fine. So basically, hiding is the middle of the chart, and then 12 is multiple bites. So cats can go from 0 to 60. Each step takes 0.1 second. So we're going to go over some of that in detail. And then, so establish your handling limits. 2 seconds of escalation, then stop. You get 2 tries. If the struggle goes for more than 2 seconds, change your approach. If the cat is agitated with 2 different approaches, they're over-escalated. Go to injectable sedation, inhalant sedation, or send them home with PVPs and try again, the gabapentin. Think about what triggered the cat and avoid that. Covering head makes them more agitated. Use the cowl technique instead, which we're going to go over today. Give Buprenex early in the exam. Just a little bit of transmucosal Buprenex. Many cats have undiagnosed pain. You can see a good effect within 5 to 10 minutes. So, first, we're gonna demonstrate how to get the cat in the carrier from the car. So, I'm going to have my sprayed feel away towel. And here's my carrier. So I'm going to spray the majority of the feel away on the top third of this towel. And then I'm going to make sure that that third is hanging over the front of the carrier. All right. You want to have a nice big bath towel. And then you're going to scoop this. You're going to press the back against your belly. And you're going to bring them into the clinic like this, okay? Limit sound and noise and movement. Make sure your path is clear. Make sure you have hands to help you get the doors. Now, so When you put your cat on the table in the carrier, observe them in the carrier first. Mildly stressed cats, ears are turning back, their body hunch is in the lower half of the carrier, they want to hide. So limit what the cat sees and hears, limit touch on this cat. Touch is a major trigger. Use an in-carrier exam. So we'll go over that first. All right. So our cat is in here, and we're going to use Tyrion for this. Come here, bud. Oh. All right. He is our cat guinea pig, if you will. So we're going to go over in-carrier exam. All right, so cover with a towel right away. So the towel acts as a barrier between the cat and your hand. It limits the intensity of the touch. And so we'll just cover them, and then it stifles the sensation. So we'll keep their head covered, and you're gonna basically, so the head's up here, I'm just gonna make sure that I have support of their neck and shoulders, and I have control of them. And then if they want to lay down, then you want to get them on their side. You're going to move them over, and then you're going to roll their back along the side of the carrier. Good boy. And then if they're wanting to eat, this is the time to offer food. I think this one's turkey. Hey, sit. So we're gonna offer some food while they're in the carrier. So here, give me those. Okay. So, all right. So a cat that's mildly nervous, fidgeting, pawing at the gate of the carrier, lots of facial rubbing, fidgeting has their body amped up. If you were to let them out of their carrier, they'd be winding around, marking, they'd jump on your high perch, they're confident. So now you have a real problem. So they're perched 4 or 6 feet high, and now they're staring at you, smacking. You can't remove him off the perch. Now he's agitated. Reaching for him would trigger him up that ladder, and it's gonna get real bad real quick. So use a towel wrap and a towel hold. If they want their head uncovered, that's something you have to determine. So the way to do that, so middle finger on the head base, tucking these two down, and then you're going to take your pinky and your thumb, and you're going to wrap that around their jawbone, okay? And so you're going to do a little test. So you have control of the head, and then you're going to do a little test, see how they feel about their face covered. More agitated. Okay, so we're not going to do that. So what we're going to do instead, never ever scruff a cat. We're getting away from that right here and now, all right? Abolish it forever and ever and ever, all right? So instead, roll your hand towel up, and you're going to wrap it around, give it a little twist, okay? Now you have a scruff, and I have full control of this cat with not a single finger touching the cat. So this is great for the cat, good for me. I have good control, and I have this pinched tightly at the top. So he's doing really well, so I'm going to reward this. Good job. All right? So remember to do your rewards. All right? So, and then towel wrap technique. All right, so now we're gonna do this same cat, but we'll do the confident cat on the table, okay? All right. So you want your towel spread lengthwise across the table, all right? And then, okay, you want them slightly near the edge of the table, and then you're gonna tuck up under the neck, make sure their feet are inside, and then you're gonna wrap over. This is the key. Hey, here. pinch here. Okay, this is where you want to pinch. This makes sure that you have these edges tied together. And that's when you bring this over, keep this pinch, okay? So now you have full control over this animal. Can you sit down, please? And so now for cats and jugular jaws, this is going to be really important. Good boy. So, so you have the cat wrapped up, and so bring your body, their back is to your front. You're going to close your elbows around their body. Here's the key. The only place that's going to touch this cat is your index fingers and your thumbs. And so your index fingers are going to go along the jawline. All you're touching is that bone. And then the thumbs at the base of the skull. Now, don't stretch this neck upwards until that person has the needle an inch away from this animal. So the longer you stretch them like this, the more it hurts, the more it's agitating, the more it's scary. So you're going to go 1, 2, 3, done. That's it. Okay. And then, all right, good boy. All right. So that was really good. So I leave him alone and he gets a reward. Hey, don't walk off the table. All right. So we did that. Okay, so that's the towel technique. And then the towel technique, we went over cowl technique. And then the other thing you can do with, hey, sit. Sit. Good boy. So let's have that same cat, very nervous, but likes its head covered, okay? So sit. Good boy. So this one, stay. I know. This one, we're gonna just pretend his whole face is in here, okay? He hates it. And this is what we're gonna do. Chip clip. Done. Okay, so this cat's head is enclosed in this towel, and then we have full control of their body. So this is where you would be able to have their head covered like that in the towel, and then you can put them on their side. Sit. Down. Down. Play dead. You play dead. Play dead. Oh, okay. All right. We're going to do this with the monkey, okay? Because that's all I have. All right. So we're covering the cat. Get our chip clip. Where'd it go? Okay. Now we have extra hands, okay? So. All right. Now, our head is inside the, excuse me, towel. So now we can go on their side, and this is important. So their head's covered. Use your forearm behind their head, all right? Now you're not gonna grab their leg, their feet. All you're gonna grab is that elbow, okay? If you can grab the one beneath, that's even better. So that's how I have this cat's elbows in my fingers, and then like it's just my wrist supporting that neck. And then same on the back. Now you can hold for 90% of the exam can be done right now, right here. So listen to the heart, palpate the belly, back leg blood draw. This animal does not have a tail, but if he had a tail, you could have access. Do not do that with a tail ever. You can go to the side. If you're gonna do anything in the rear of a cat or even a dog, it's nice to use some lidocaine gel, wait a few minutes, and then try to the side, never up, okay? It's very aversive. So then, Now let's do moderately aggressive cat. So hiding in the back of the carrier, mild hissing, don't reach into the carrier, all right? So let's say this cat's in here. These bolts are rusted shut. I can't get it open. So you're gonna have an empty, he's in it. Here, look. You're gonna have an empty carrier ready in your exam room for you to use, all right? So what you're gonna do, you are going to set this on your table. You're gonna have your towel, and you're gonna put it over the back half of the carrier with this being open. So this cat who's hissing and wants to hide, it's in the back of the carrier beneath the lower half, okay? So I'm expecting her to want to go in here, and this is ready to go over, all right? So what we're gonna do, we're gonna have our monkey in here, and what we're gonna do, we're gonna open this, and I'm gonna hold this, and if you're worried that they're gonna get their hand caught in this area, you can cover this up with a towel and hold the cage door open, and then you're gonna hold this at an angle, and we're gonna do the slow dump truck, all right? Step, and then that cat is going to hopefully go under, but even if he goes over, you have this ready to go over, all right? So, so then, as soon as you have access to that cat, then you can administer your oral buprenorphine dose, transmucosally, 0.3 mils of 0.3 mg per mil per cat. Wait 5 to 10 minutes, and then you can use your towel technique inside the carrier. So you have your towel, you have your patient, and you're going to have somebody having control of that, the shoulders and neck area usually, just have their hands on them, and then do the in-carrier towel technique that I showed you earlier. So for the facial exam, come here, Tyrion, come here, come here. Okay. So for a facial exam in a cat, sit down. So, never want to approach the cat from the front. It's super scary to them. So, use a call technique if you have to, so you have good control. Always do the most invasive and most painful things last. Looking into a cat's mouth is so aversive, second only to rectal palpation, all right? Looking in the ears is third. So, always come from the back or the caudal half of the cat, and then come in for a quick peek, back off, all right? Sit. So you have the, let's say we have the cowl here. So I'm trying to limit my hands touching the cat. Sit down. So the cat's facing this way. I have my cowl. So I'm gonna come, look, back off, all right? Same thing, look, back off. And then for oral exam in a cat, Q-tip, baby food. Get all the way back, nice. And on this side, see, nothing of my skin is touching this cat to increase its aggression. So then, let's see. So let's do high aggression, hissing, swatting, striking in the carrier before you've even looked at it. You look into the front of the carrier, it's hissing and swatting. Don't open that carrier. All right, so leave them in the carrier, send them home with meds to return later. Or you can do the quick injection technique in the carrier, dexdomitor and butorphanol, or midazolam combo. in carrier injection. So it takes a highly skilled technique, timing, handler, lift the carrier, cover the cat with a towel, inject, close, pull the blanket out. All right, it's got to be quick and effortless, seamless. Or inhalant anesthesia. So the slow dump truck technique into the clear glass container in the middle of treatment, it's a little much. So alternatively, you can put a garbage bag right around the carrier and close it at the front, and then put the anesthesia in there until the cat falls asleep. So a picture of that is right there. All right. And then the next thing, so if you're doing that, you want to get everything done quickly. IM, pain relief, meds, anything you need to do it quick, and then recover them in their carrier, send them home with pre-meds for next visit, and then consider telemedicine for rechecking that cat. Less than 1% of cats should really need this if you're practicing good, low stress, fear-free handling in your cats. So, so keep your chip clip handy, and then don't hold the feet, hold the elbows. Think of cats as sunburned cats. So any touch on them initiates anxiety and stress, all right? So the other thing we're gonna do is pillowcase. So pillowcase technique can be really advantageous in cats, especially cats who have an aversion to the towel. So those, 20-year-old cats who have been coming to the vet and they get covered with a towel, 3 people lay on them, they may have a true aversion to towels. Or your client brings the cat in, not in a carrier. So bring your pillowcase out to the car, and we're gonna go over that right now. Good boy. Okay, so our pillowcase went right here. Okay, so we are going to, if you've ever put on pantyhose, you grab the open ends, and you're just gonna scrunch, bunch it up along the sides in your hands, all the way down. All right, so now you have the bottom corners and your open top. So you're gonna try to make this seamless and quick, all right? No, down. All right, so you're gonna go over the head first, all right? Get it in this little corner. And then if you're worried that this cat's gonna bite you, you can wear like a little work glove or gloves. I'll tell you about the gloves in a second. So head first, and then put the other side over the butt, and then bundle it, and then keep your hands flat on the table, bunch it up, and then close it up. Good boy, bud. Hang on. All right, hang on. So then from the pillowcase, you can access their head, and then use your pinch technique. I'd actually go the other way and pinch it from behind, but he got kind of cattywampus here. There we go. So you can use your towel technique inside your pillow case and do everything you need to do, still having their whole body and everything contained. Or you can cover them and pull out different parts of the body, or put this pillowcase over just the front half of them. So then you have access to their back legs for a blood draw and everything else. I dropped my baby food everywhere. Good boy, Tyrion. He did really good for that. All right, so now I'm a total mess. All right, so, oh my gosh, you're making a big old mess. Okay, and then what's cool about the pillowcase too is you can go straight to injectable medications. The key to that is, so you have this cat, you have control right here, okay? And then inject. And then the key is push them away from the poke. because they're going to want to go that way, but they're not going to be able to or know how. So then push them away so they think that the thing that poked them is now away from them. So it escalates and then de-escalates them right away. All right, so that's pillowcase. We went over a jugular blood draw. So let's go and talk about hospitalizing cats. So limit the hours cats spend at the clinic for drop-offs and surgery. Do their treatments in a quiet, closed room. Radiology, the bathroom. A lot of cats like to go into the bathroom and just hang out with their owners while they're, taking a dump and taking a shower and hanging out. So it's not usually aversive to cats. So if you're at a loss, try that. Take them into the bathroom. Take their blood pressure there. So treatment area, think about what that space is like, what we can do to make it better for the cat. So a track curtain, stay away from the dental machine, the high ultrasonic sound, loud people, sudden movements. Use quiet clippers. Blade 30 is adequate for an IV catheter. And always hold the clippers flat so you don't cause razor burn. Keep the cat in the carrier before and after care. Medicate them before the treatment starts. So mucous membrane, Buprenex, gabapentin if they hadn't already given it. Cats being aggressive in the cage. So this one we're gonna pull out our fake cage. All right, so we're gonna do our cage right here. All right, so you want to get a big blankie, and we'll have our monkey as our cat hiding in the back of the carrier. All right, so get your big old blankie out. Make sure it's thick. All right, and then you're gonna have 1/4 of it over, your arms, and then you're gonna go in like this, and you're gonna body block the cat, and if you need to take out the food and water, you're gonna just kind of block the cat into this corner, and don't let them see your hand approaching to take food and water out. All right, and then if you need to scoop that cat out, you have it over your hands. You're gonna scoop that 1/4 bit over the cat. You're gonna get it underneath them. You're gonna be in this position. All right, you're gonna hold them, and then you're gonna squeeze that and work on this motion on a regular basis. Keep those elbows in tight beneath it, and then you have a secure grasp of that cat. And you can put them right into the bottom of a carrier from there. You can take them to treatment. You can do a bunch of different things from here. All right, so let's do a scenario where we need to get them back into the carrier and they're hissing, swatting, and we're not going to use that towel technique. So instead, we're gonna do something similar to when we got them out of the car this morning. So our cat's in there. And then we're gonna get our big towel and 1/3 of it over our arms, and we're gonna go with enough to go over and under the front of the cage. Oh, I'm covering my baby food again. I don't even know where it is. All right, you're gonna go under like that. All right, so I think we actually have to take the door off for this part. Yeah, you gotta take the door off, and then when you put the door on later, yeah, we'll figure that out in a minute. But anyway, I just want to show you. So you go in like this, the door is off, and If you have all this space here and you need to cover that up, have a couple toss pillows ready, depending on the size of your cage, to just account for that space. And then you're gonna go in like this. You're gonna go all the way to the end, and then with your hands, I'm gonna move this so I can show you. You're gonna get all the way to the edge, to the back, and then take your pillow out. You're all the way back. Well, you gotta get your cat in there. Let's just assume that they're in there for argument's sake. So you're gonna go